Thanks so much. So this talk was designed for a conference called Wellapalooza that's going on right now in Virginia, and I spoke there yesterday. So the woman who organizes Wellapalooza is Kendra Nielsen-Miles, and she and I have been talking about integrative approaches to the management of Ehlers-Danlos syndrome for many years. She herself has Ehlers-Danlos syndrome, and she's worked really hard to use integrative approaches, non-pharmacologic approaches, to optimize the quality of life for herself and also for her family. So we've been talking about what can you do? How can you optimize the quality of life? How can you use your own efforts to make things better for yourself and your family members if they are also affected? In general, we'll just be talking approaches to integrative health for persons with EDS. And there are many, many common symptoms that are amenable to integrative approaches. They include musculoskeletal pain, chronic fatigue. Many, many people struggle with headache and migraine. Most of my patients, when I ask them if they have headache, they not only have headache, they have 3 different types of headache. You know, they can tell me. And the GI issues, as I mentioned earlier, dysmotility is a very common feature. We also see things like sphincter of Oddi dysfunction, which interferes with the flow of the digestive juices into the GI tract. Brain fog and cognitive issues are extremely common, and here again, there are probably 7 different reasons why people with Ehlers-Danlos syndrome might have brain fog. People present with multiple sensitivities to food, to chemicals, other things in the environment. ADD and ADHD are very common in this population. They're pretty common in the general population also, so I don't actually know if they're more common in Ehlers-Danlos syndrome or not. And anxiety and depression, definitely a big comorbidity. The joint issues are the fundamentals, the joint laxity, subluxations, dislocations, and chronic joint pain, pelvic pain, and chronic bruising. So the underlying comorbid conditions that lead to those symptoms include mast cell disease, and I don't know how familiar you all are with mast cells, but the mast cells are the cells, they're like our first responders, and they throw out little packets of inflammation whenever they degranulate. So if the mast cells are irritated, they're throwing out over 70 different inflammatory cytokines, and those cytokines can influence every single organ system in the body, and they manifest in different ways in different organs. So the mast cell disease can really be a unifying explanation for many people's symptoms. POTS, or postural orthostatic tachycardia syndrome, and dysautonomia, also very common. And we know that the mast cell disorder can exacerbate the dysautonomia and vice versa. When the dysautonomia is worse, the mast cells get worse, and then that makes the POTS worse, so it becomes a spiral. Fibromyalgia, chronic tender points, and chronic musculoskeletal pain overlap to a great degree with the Ehlers-Danlos syndrome phenotype, and many patients who are ultimately diagnosed with Ehlers-Danlos syndrome have been told in the past that they have fibromyalgia. And chronic fatigue is also extremely common, and this is not just, I'm a little tired. This is like, I literally cannot get out of bed. And many of my patients have told me, Doc, I can deal with the pain. I have ways of managing, but the fatigue is really what takes me out. So the fatigue can be the major complication that really interferes with the quality of life. It causes people to have to lose their jobs, causes them to have to withdraw from society because they just cannot even get out of bed. Now, for some reason, autoimmune conditions seem to be more common in this population, and I think it's because of the immune dysregulation that we see, but that really requires a lot more exploration. We don't have the complete answer to that. Functional GI disorders, as I've mentioned several times. Allergies, very, very, very common, and there are multiple endocrine disorders that we also see. Now, one of the main reasons for this is that there are several causes of increased intracranial pressure in the Ehlers-Danlos syndrome population. And if you have increased pressure in your head, that's going to impact the pituitary. And if the pituitary is getting squashed, then that's your master gland for your hormones. And so that can impact the thyroid and the adrenal glands and all of the other glands in the body. Pelvic dysfunction is very common because the pelvic floor may be very weak. There are a lot of tendons and ligaments that hold up the pelvic organs. And so if those are not functioning properly and the muscles in the pelvis go into spasm to try to hold things up, then you get a lot of chronic pain. So that can be a really major issue. And people who have joint laxity are also more prone to developing wear and tear arthritis or osteoarthritis. Now, this is a brochure that Kendra developed to talk about integrative healing in Ehlers-Danlos syndrome. And it is available at her website, which is EDS Wellness. So you're welcome to go and check that out. But I'm going to talk about the points that she makes in this brochure. Number one, it's very important to remember you're not alone in this journey. There are many people out there who live an active and full life with Ehlers-Danlos syndrome. And the brochure is designed to provide guidance in managing the symptoms. So many people have gotten to the point where they get their diagnosis of Ehlers-Danlos syndrome. They've really been on a winding road, and it's been a lonely road for many of them. And what we're hoping to do is provide actionable steps for living well for people with Ehlers-Danlos syndrome. I always recommend to people to try to improve one area of health at a time. Nutrition, sleep, pain, whatever it is, you pick one thing, really go to work on it, and take one step at a time. Start slow. It's very important to be patient, to recognize that you didn't get to where you are in a day, and it's not going to go away in a day or a week or probably even a month. It's very important also to focus on what you can do, not on what you can't. You know what they say, how the body, your body responds to where your mind goes. So if you're thinking on the positive side, your body will move in that more positive direction. And the little things count. So I always tell my patients it's really important to be moving. And some people feel like, are you kidding me? I can't even do 2 minutes. So I say, okay, do 1 minute. Do 1 minute 30 times a day. That's 30 minutes of movement during the day. But just start small and be patient with yourself. So something is always more than nothing. And it's so important to find a physician who can be your partner along the way and is open to the ideas of using some integrative approaches and isn't just going to want to give you a pill and another pill and another pill. So you want to keep a record of what you're doing, make sure that so you know 2 years from now if somebody suggests something that you've already done, you can go back through your notebook and say, okay, I did that, didn't work for me. And really try focusing on just 5 minutes a day of getting going. Dr. Chopra, this is Pradeep Chopra. He's a pain management doctor up in Rhode Island. And he says about everything related to Ehlers-Danlos syndrome, start low, go slow. And this applies to exercise, medications, pretty much anything you might try to do is to take it slow and start at maybe half or a quarter or an eighth of what people might do in the absence of Ehlers-Danlos syndrome. Nutrition is absolutely key. I cannot begin to tell you how many patients have told me, I changed my diet and it changed my life. And so we know, and there are hundreds of studies out there in the peer-reviewed literature, that proper nutrition is absolutely vital to staying healthy. You want to eat real foods, avoid processed foods, nothing artificial. Many people will respond very well to an anti-inflammatory diet. This comes back to the mast cell issues. And this www.histamineTolerance.ch provides a list of foods and food additives with their histamine potential. Histamine is one of the major inflammatory molecules that is released by mast cells, and that's why we use antihistamines in the treatment of those mast cell symptoms. But we also know that changing the diet and avoiding the histamine triggers can be really, really helpful. So with that list, what I usually recommend to people is to start, each food is classified as 0 to 3. The 0s and 1s have minimal effects on histamine levels, the 2s and 3s progressively more so. So what we do is 3 weeks sticking with the 0s and 1s, and then each day after that you can add in one food that's either a 2 or a 3 and see whether it causes any symptoms. Does it cause pain, abdominal pain, bloating, GI disturbance, brain fog, any of those things? And if it does, then you know you just want to keep it off your diet. If you don't get any effects, then you can add it to your list. That's fine to eat. In addition, there are certain foods that we know have a pretty significant inflammatory effect. These include gluten, dairy, sugar, soy, and alcohol. And so avoidance of those significant inflammatory foods can also be very helpful. One of the things I learned a little bit more about this weekend at the Wellapalooza event was the importance of the gut biome. This seems to be really playing such a key role, and the foods that we eat change the bacteria that inhabit our gut, and those bacteria can change how we feel. So using probiotics to enhance the presence of those so-called good bacteria can be really, really helpful. For people who have orthostatic intolerance and other forms of dysautonomia, getting enough salt is also very important. Now, everybody needs enough hydration, and really in the US these days, most people don't get enough water. We know this. So if you take your weight and divide the weight in pounds by 2, that's the number of ounces of water that you should be drinking every day. And most of us don't get anywhere even near that. But for people who have orthostatic intolerance, it's also very important to be getting enough salt. And so there are a number of different salt supplements that you can use. I recommend the NUN tablets, NUUN, which are little like fizzy kind of things you can put in a bottle of water. There's a product called Salt Stick and Banana Bag. Any of those will provide good electrolyte supplementation. And then there are really a wide range of herbal supplements out there that can really make a very, very significant difference depending on the type of symptoms that people are experiencing. So I'm really open to the idea of using herbal supplements to help enhance your quality of life. The core nutrients, you want to be sure that you're getting enough of all of these things. Vitamin C is really important for the maintenance of a healthy connective tissue. Vitamin C is a cofactor for many enzymes that are important in connective tissue or collagen metabolism. Vitamin D3, we know that people who have low levels of vitamin D3 are going to have increased levels of inflammation and increased pain. And my target is usually between 40 and 50 for the goal for vitamin D level. You want, like most labs will say that the normal range is between 20 and 100, but for most people, 20 is really too low. You want to get it up in the 40 to 50 range. And that's going to be important not only for your bone health, but musculoskeletal health and overall well-being. Vitamins B6 and B12, magnesium, calcium, zinc, and iron. A diet that's rich in fruits and vegetables will get you most of those. One comment about magnesium, most of us are not magnesium replete these days. Most of us are deficient in magnesium because many farmers are not rotating their crops the way they used to, and the soil has become depleted of magnesium. And muscle spasm is really the major cause of pain for people who have joint hypermobility because the muscles are trying to do the work that the tendons and ligaments are not able to do. So the muscles go into spasm. And magnesium is the key for opening the muscle spasm. If the muscles are in spasm, you need magnesium to open that lock. So magnesium supplementation can be extremely helpful, and Epsom salts are a good way to get magnesium because you don't put it through the GI tract. Sometimes oral magnesium can cause GI disturbances. Now, people who have chronic illness are under chronic stress. There's just no way around it. The illness itself is stressful. Chronic pain is stressful. Stress causes physical pain, and physical pain causes stress. So stress reduction is also a major element of any practice to try to get people back to living a good quality of life. We know that the autonomic nervous system has two parts, the sympathetic, which is the fight or flight reaction, and the parasympathetic, which is the rest and digest. And they're like a seesaw. If one is high, the other one's low, and vice versa. So we want to damp down that fight or flight reaction and enhance our ability to live in the rest or digest space. Acupuncture is a really good way of balancing the autonomic nervous system. Mindfulness techniques of meditation and guided meditation can be very helpful. Biofeedback is enormously helpful for this, and craniosacral therapy also extremely helpful. Exercise is our key. I've often heard it said that if we had a pill that could do all the things for us that exercise does, people would pay $1,000 a pill for that medical intervention, right? And we have it at our fingertips. We can do it. It's just up to us. We have to get out there and move. Sleep is so important. There's a reason that people use sleep deprivation as a form of torture. You know, a lack of sleep really can wreak havoc on your body. So we want to do everything we can to get a good night's sleep every night. And there are a number of ways that we can do that. There are a bunch of different apps out there, relaxation apps and mindfulness techniques. Some people find that a white noise machine is really helpful. You want to make sure that the room temperature is not too hot, not too cold. You want to make sure you're not using any screens within an hour before you go to bed, because this decreases melatonin production and decreases your own body's ability to get you to sleep and stay asleep. And a warm shower before bed can also help with relaxation. Melatonin and ashwagandha are two supplements that can be very helpful for sleep, and that's something you need to kind of adjust and work with, figure out what's best for you. Pain management. As I mentioned, pain in Ehlers-Danlos syndrome, there are many, many different causes of pain. People can have both musculoskeletal pain and neuropathic pain caused by inflammation of the nerves. Most of the pain is going to be musculoskeletal and related to muscle spasm. So we spend a lot of time and energy thinking about how can we get the muscles to relax. And physical therapy for muscle relaxation is going to include deep heat, ultrasound, massage, the use of a TENS machine, which is transcutaneous electrical nerve stimulation, Laser therapy can also be very helpful to cause the muscles to relax, infrared and cold laser. Some people find that castor oil packs on the abdomen can help with muscle relaxation in the abdominal wall. There are massage pillows available. Trigger point therapy is useful for those places where people develop what we call myofascial trigger points. And those happen at the places where the muscles interdigitate with the tendons. And the tendons are loosey-goosey, they're not doing their job, so these muscles are going into spasm. And there are a number of different ways that you can get those myofascial trigger points to relax. Some people use what they call dry needling with acupuncture needles. Some people use manual manipulation. But there are many different ways, but you have to know that the trigger points can be an issue. Trigger points not only hurt where they are, but they send referred pain through the connective tissue to distant locations. So people may have pain in one location, and the focus is at that location. For example, you can get really bad pain in the knee from trigger points up and down the thigh. And the orthopedist will look at the knee, they'll do an x-ray, they'll do an MRI, they might do arthroscopy. Fine, no problem with the knee, you know, and then you get into, well, it must be in your head, right? But really what it is a trigger point that's in the thigh. Those trigger points, if they are alleviated, then the knee pain goes away. And there are multiple supplements that can help with pain management. Turmeric and arnica are two of the ones that are really very effective. Turmeric is a very powerful anti-inflammatory superfood that inhibits NF-kappa B, which is, it's the king of the inflammatory cytokine pathway. So if you can knock out NF-kappa B, you can really eliminate a lot of the inflammatory molecules that come after it. And arnica is a very, very helpful external remedy for bruises, sprains, and sore muscles and joints. It's made by crushing the whole plant and soaking them in alcohol. But you have to remember that arnica is toxic if it gets internally, so you don't want to apply it to any area of broken skin or on an open wound. And then, as I was saying about movement, very, very important. You want to track your daily steps using an app or device like the Fitbit. I'm a very big advocate of aquatic physical therapy. A lot of my patients tell me they just feel the best when they're in the water because they're not fighting gravity. The water holds people together. Warm water actually will help keep the muscles relaxed while you're exercising. And things like Tai Chi and yoga, cycling can be really, really supportive of movement in people with joint hypermobility. There are some places that offer Tai Chi in the water, I've seen exercise bicycles and other exercise equipment in the water. So this is something to explore, and it's a way of getting some movement, low impact movement into the day. So, and I mentioned mindfulness earlier. Mindfulness is a mental state, and it's achieved by focusing a person's awareness on the present moment, calmly acknowledging and accepting one's feelings, thoughts, and bodily sensations. And it's used as a therapeutic technique. You would be amazed at the amount of literature that's out there about mindfulness and mindfulness-based stress reduction and the many, many different medical issues for which it has been proven to be enormously helpful. So this is the brainchild of Dr. Jon Kabat-Zinn, who launched mindfulness-based stress reduction over 25 years ago at the University of Massachusetts. These are some books and resources that I recommend to people. The Last Best Cure by Donna Nakazawa, Move Your DNA, a really good book about movement therapy by Katie Bowman. Jon Kabat-Zinn's book on full catastrophe living, and he has a new one that's recently been published. Dr. Clair Davies' Trigger Point Therapy Workbook. There's a whole life nutrition cookbook, and Is Food Making You Sick? This is a book about histamine, low histamine diet. And then Terry Walls has written recently about her experience as a physician with multiple sclerosis and how she got back to a normal, healthy life by changing her diet after becoming really very severely disabled with multiple sclerosis. So just some general tips for success. You want to keep a critical eye on your own results. Throw out what doesn't work, just put it away and hold on to what does. General stress reduction is a key element to this for mast cell issues, and anti-inflammatory strategies are important for all. So thanks to Kendra Nielsen-Miles, who really did an enormous amount of work in the preparation of this presentation, the Ehlers-Danlos Society and EDS UK, and my colleagues in the EDS Society, and my patients and their families. Thank you so much.